Hi, good morning. My name is Rija Chen, and this is my student car. In this presentation, I will report 4 main parts. First, I will discuss case overview. Second, I will introduce a comprehensive E2E assessment. Then, I will introduce 4 key nursing interventions. Finally, I will introduce the specific nursing considerations for 3 medications. Today, we are talking about the stroke. Stroke is a clinical syndrome causing hypoxia and damage to brain tissues. It occurs when the blood supply to the part of the brain is interrupted. Do you know how many types of stroke there are? It can be classified into ischemia and hemorrhagic. Therefore, stroke is one of the leading causes of disability and death worldwide. In this case, Teresa has an embolic stroke and atrial fibrillation. She was found with decreased level of consciousness, slurred speech, and left side weakness. From the airway assessment, Teresa currently has a clear airway and receives oxygen at 6 liters per minute by Hesston mask. Stroke can impair the function of the nerves and muscles that control swallowing, so it's hard to clear secretions. Patients should sit down to maintain airway patterns and airway protection. For Teresa, this position is an important nursing strategy to protect her airway and support breathing. From the breathing assessment, Teresa's breathing was shallow and fast. The oxygen saturation maintained at only 95%. Air entry was equal on both sides, but oxygen level in the lower parts of the lungs were reduced. This may be cerebral ischemia, affecting the respiratory control centers in the upper pons to change the rate and rhythm of breathing. The limited improvement in oxygen saturation after oxygen therapy also suggests alveolar hyperventilation. In older patients, oxygen at the lung basis may be lower because of reduced chest wall movement and prolonged bed rest. During oxygen therapy, blood oxygen saturation should be closely monitored and keep between 96% and 98%, since high oxygen level can cause cerebral vasoconstriction and oxygen toxicity. Nurses should change the treatment plan according to the oxygen level to prevalent hypoxia and hyperoxia. From the circulation assessment, the patient currently has tachycardia, cold extremities, high blood pressure, capillary refill time of less than 3 seconds, and pitting edema. Activation of the sympathetic nervous system, increased heart rate and blood pressure, helping to maintain cerebral perfusion. However, sustained hypertension may increase intracranial pressure and increase the risk of cerebral hemorrhage. In this case, careful blood pressure control is essential to reduce the risk of cerebral hemorrhage. The edema may be due to prolonged bed rest and poor venous return. High blood pressure can also increase capillary hydrostatic pressure, which makes more fluid move into the interstitial space. In this case, nurses should monitor blood pressure and fluid balance closely to prevent heart failure. Moreover, the patient has a history of atrial fibrillation, which suggests that the stroke could be caused by a cardiac embolic event. Therefore, continuous monitoring of vital signs and ECG changes is important for potential arrhythmias. From the disability assessment, Teresa's GCS score was 12, with dysasia, numbness of the left limbs, and facial paralysis. Motor function on the right side, pupil shape, and blind reflex was normal. Research showed that when an embolism affects the middle cerebral artery, collateral hemiplegia often occurs. Aphasia generally occurs as a result of injury to the left middle cerebral artery, but in this case, the lesion was in the right hemisphere. In this case, the patient's speech difficulty was likely from laryngeal and facial muscle weakness related to the right motor context. Ischemia of the reticular activating system can lead to a lower level of consciousness. In this case, Teresa's level of consciousness may continue to decline. Nurses should perform GCS assessment regularly. On the exposure assessment, Teresa had no visible wounds or active bleeding. Body temperature was between the normal range, and intravenous lines was accepted. The absence of trauma helps to exclude traumatic brain injury, and normal temperature suggests that there is no post-stroke hypoxemia. Research showed that fever during the stroke may increase the risk of death and worsen neurological outcome. Therefore, nurses should monitor and control patients' temperature. Now, I would like to draw your attention to nursing interventions. In the management of acute ischemic stroke, the first high-priority nursing intervention I would like to highlight is to keep the airway open and restore effective breathing. If ventilation is not restored in time, hypoventilation may cause hypercapnia, which can increase intracranial pressure and cause further brain injury. In this case, Teresa needs to be positioned sitting up to maintain airway patencies. Nurses should monitor her breathing and provide oxygen. Ensure that oxygen saturation is between 96% and 98%. The second nursing intervention is controlling blood pressure. When systolic blood pressure is above 185, the effectiveness of intravenous thrombolysis greatly decreases. Therefore, blood pressure needs to be maintained below 180/105 to ensure the best therapeutic effect. However, the rate of blood pressure reduction must be carefully managed. A rapid drop in blood pressure may lower cerebral perfusion and worsen ischemia. When using the antihypertensive drugs, blood pressure should not fall by more than 20% within 24 hours. In this case, the patient was preparing for intravenous thrombolysis, and her blood pressure was close to the target level before treatment. Therefore, nurses need to reduce her blood pressure and monitor blood pressure to prevent secondary cerebral ischemia. The third nursing intervention is monitoring the patient's level of consciousness continuously. Stroke often causes swallowing difficulties and weak gag reflex, which increase the risk of aspiration. A reduced level of consciousness may also impair breathing and lead to hypoxemia. Additionally, some patients may experience neurological decline after stroke. Research recommends that nurses need to perform neurological assessment at least every hour after intravenous thrombolysis. In this case, nurses need to do the GCS assessment hourly with special attention to the risk of airway obstruction. The last nursing intervention is intervention for dysphagia. From the previous assessment, we found that Teresa has slurred speech caused by damage to her laryngeal function. The current nerve injury could also lead to symptoms of dysphagia. Difficulty swallowing not only increase the risk of aspiration, but may also cause poor nutrition and emotional distress. To improve swallowing abilities, nurses can use thickened fluids to reduce choking, provide nutritional supplements, and to maintain energy intake, and perform regular oral care to prevent aspiration pneumonia. In this case, stroke may have affected patients' laryngeal neuromuscular control. Early assessment and nutritional support are essential. Now, let's talk about medicines. Before giving autoplays, it is essential to confirm that Teresa's symptom onset was within 4.5 hours. Blood pressure should also be kept below 180/105. Autoplays increase the risk of bleeding. Brain imaging must be performed before treatment. During therapy, nurses should monitor vital signs and check for any signs of bleeding to prevent serious complications. Autoplays may also cause reperfusion arrhythmias, so ECG changes should be observed closely, especially Teresa's heavy atrial fibrillation history. The elderly is at higher risk. When using this medication, Teresa should be informed of potential complications before treatment. After talking about autoplays, the next important medication is heparin. The main adverse effect of heparin is bleeding, so hematocrit and blood pressure should be checked closely before and during treatment. Nurses should ask about any history of bleeding disorders or previous heparin-induced thrombocytopenia. Heparin may cause thrombocytopenia. Nurses need to monitor Teresa's platelet counts regularly during therapy. Nurses should review coagulation results regularly so that the dose can be adjusted to maintain effective anticoagulation and reduce bleeding risk. For older patients like Teresa's, nurses should start with lower dose. Finally, the last medicine is metoprolol. Before starting metoprolol, Teresa should be assessed for any history of obstructive airway disease or asthma. Nurses need to inform Teresa that this medication may cause side effects such as tiredness, dizziness, low heart rate, and low blood pressure. Nurses should monitor Teresa's blood pressure and heart rate regularly before and after treatment. If the heart rate falls below 45 beats per minute or the systolic blood pressure drops below 100, nurses should reduce or stop the medication gradually. In conclusion, nurses play an important role in the care of patients with embolic stroke. A systematic A2E assessment helps to build a clear understanding of the patient's overall condition. Moreover, key nursing interventions such as airway protection, blood pressure control, neurological monitoring, and swallowing assessment may improve cerebral perfusion and reduce the risk of complication. In addition, standardized medication management provides important support for the patient's recovery. And that's it. Thank you for listening.